Hello, Kent County. We received some important news from the FDA and CDC recently. Booster shots of the Pfizer vaccine are now recommended for people aged 65 and older, people living in long-term care homes, people with underlying health conditions, and to those people who are 18 and older who live or work in high-risk environments. Those boosters are available if you received the Pfizer vaccine originally and if it has been at least 6 months since receiving that second dose. For those of you who are vaccinated with the Moderna or Johnson & Johnson products, please remain patient. We expect to hear more information about boosters of those products soon. We've also heard good news from Pfizer about the efficacy and safety of their COVID vaccine for children between the ages of 5 and 11. It is very possible that the FDA and CDC could have an authorization and recommendation for the use of the Pfizer vaccine for those kids within a month or so. Please know that the Kent County Health Department and our many healthcare and public health partners will do everything we can to make the vaccine available at that time to parents who choose to have those kids vaccinated. As a dad to an 11-year-old, I can tell you that my wife and I have been very eager for the vaccine to be available because we want to see our daughter stay healthy, and we also want to see her stay in school. We also want to see life return to normal in as much as possible for these kids. Facial coverings, quarantines, and social distancing may have been necessary for the safety of the community, but we all desperately want to recreate a world where our kids don't have to worry about those things. Vaccine is the fastest and safest way to get there. The good news continues to be that the COVID vaccines work as intended. Now, I know that some people point to breakthrough cases as evidence that they don't work, but keep in mind that similar to facial coverings, seat belts, sunblock, and football helmets, no risk-reducing preventative tool is ever 100% effective at eliminating all risk. Think about this for a moment. Right now, approximately 50% of all Michigan residents are vaccinated. If vaccines did not work, we would expect similar numbers of deaths and severe illnesses amongst vaccinated and unvaccinated Michiganders. Between the period of August 9th through September 7th, 35 vaccinated Michiganders died from COVID-19, while 149 unvaccinated Michiganders died from it. 275 vaccinated residents were hospitalized during that time frame, but 820 unvaccinated residents were hospitalized during that same period. And the hospitals tell me that those unvaccinated hospitalized people are generally in far worse condition. This latest surge is very much the wave of the unvaccinated. Please choose to get vaccinated for COVID-19. I want to see our schools full, our restaurants full, events full, and our hospitals not full. COVID vaccination is the fastest and safest way forward to that reality. And while you're at it, please get your annual flu shot as well. People can get the influenza and COVID shots at the same time. We were fortunate last year to have a mild influenza season. Experts think that that was due to all the social distancing, the facial covering use, the hand washing, and the fact that there was very little travel between the southern and northern hemispheres. Those protective factors are just not in place to the same extent this year. We do expect a more severe flu season in the coming months. Let's do what we can to prevent what's preventable. The Kent County Health Department is taking appointments for immunizations, including COVID, for boosters, and influenza. If you would like to schedule an appointment, please call us. Call us at 616-632-7200. A variety of other healthcare providers and pharmacies throughout West Michigan are also offering vaccines. Please go to vaccinatewestmi.com for more information, and thank you for doing your part to keep infectious diseases under control.